Hi everyone, Aaron Brooks with Perfect Postures, and today I want to talk about heel pain. A lot of times heel pain could be due to some type of stress to the Achilles tendon, or a lot of times that could actually leading to or be part of plantar fasciitis, which would be basically the bottom of the foot pain all the way through here. Now, one of the interesting things about this is, as most of you know if you've been following our videos, we don't treat symptoms, but what we do is we address biomechanical factors that may be the underlying cause for a particular symptom or a diagnosis. So in many cases, when we're looking at someone that has that type of pain in the heel or even at the bottom of the foot there, one of two things could happen. Usually we're going to either see a rotation in the pelvis where one side is rotating forward, or a lot of times we'll see a elevation in the pelvis. So maybe the right side is higher, and what that does is it creates a leg length disparity. Now these are important because when you start looking at the human body, and as much as we want to think that the human body works in individual parts, it doesn't. We work in kinetic chains, how one part directly affects the other. So if you were to imagine that the back side of the body, you started from this point and you brought it all the way down to the heel, and then you elevated that side, so I'll show you from the front view, and this side was higher. If you take those 2 points and you take them or pull them away from each other, you're actually creating more tension through there. So a lot of times people with those symptoms, they'll come in and I'll ask them about their health history, and they'll say, well, I did a lot of stretching for my calves because I was told that my calf, my gastroc, and my soleus muscle were really tight. Well, yes, it felt tight, but it felt tight because it was actually elongated already. So when you stretch a muscle, it feels tight, right? So that's the same thing here. When you look at this whole backside of this chain, it's tight because of the elevation, so it's actually creating more tension all the way through the backside of the body. And then you compound that with activity or just walking or really anything, and that area is going to be affected. So what you may want to do is just take a look in the mirror, and you can even just kind of palpate, hit the top of your, what's called your iliac crest, and just kind of see if one side's higher than the other. Or maybe you'll see one pant leg that seems to be always hanging off one side, or maybe your belt line's a little bit lower than the other. So give that a shot. Take a look, and maybe you'll find the underlying cause for your pain. And then stay tuned also for the corrective exercise of the week. We're going to talk about an exercise that could actually help pull that pelvis down to take that tension away. So stay tuned.